I'd like to start by introducing Nancy Mock of Tulane University, who's joining us today from New Orleans. And Nancy brings extensive experience with diverse methodologies for both qualitative and quantitative M&E and food security information systems, including remote work in multiple countries. And we have Tim Frankenberger. Hi, Tim. President of Tango International, an anthropologist by training, calling in as the sun rises in Tucson, Arizona, here in the US. Tim has championed qualitative and mixed methods approaches for, I don't know, Tim, should I say how many years?
Sure, go ahead.
And Tango has also carried out a number of remote studies, primarily targeted at the level of institutions and government partners. And we also have joining us from Nairobi, Greg Makabila. And he is the Monitoring, Evaluation, Accountability, and Learning, or MEAL manager with the USAID-funded Development Food Security Assistance Activity of CRS in Ethiopia. So hopefully Greg, I'm sure Julia is working on that connection now to get him back with us. We'll say hello to Greg when he's able to join us. But we got in touch with Greg because over the past month, he quickly mobilized to start up remote post-distribution monitoring that includes qualitative data collection. And Greg, welcome back. We're glad you could be here. We've just introduced you. So with that, I just want to thank all of you for being here. To get started, Nancy, I want to direct our first question to you because you are in part the inspiration for this session. So we all know that what underpins good qualitative research is trust, rapport, really engaged interaction between people, typically in close proximity. So what do we do then with the imperative of social distancing during this global pandemic and the need for real-time information and some of those nuanced findings that you can really get through that qualitative approaches? In various online events and conversations over the past month, we began to hear that with so many constraints and stress on our M&E capacity that are related to the pandemic, qualitative methods would be less feasible and would be deprioritized with greater reliance on quantitative remote quick surveys. So upon hearing these remarks, I immediately recalled a conversation that we had a couple of years ago when you shared with me your experience doing remote focus group discussions in Somalia. And so I just thought to myself, it can be done, it can be done. And so the idea was born to create a conversation where we can discuss in a bit more detail why it matters and how, and some tips and techniques that we can use in these circumstances.
Great, well, let me just...
Oh, sorry, go ahead, Nancy.
Yeah, just let me get started, and I'm hoping my other panelists can chime in. You know, I'm a developmental evaluator at heart. I was trained as an epidemiologist and heavily in quantitative methods. And as I rolled out my career, I really got more and more enamored with mixed methods because of their relevance to these dynamic and changing settings. And especially as we get into this resilience thinking and programming, the notion that the contexts are constantly being disrupted. And the way that I discovered remote focus group work was actually in Somalia. Between 2014 and 2017, Tulane was a learning partner with World Vision and actually with CARE on Office of Foreign Disaster Assisted resilience programs. And in 16-17, as you remember, there was a drought. And on top of that, in the areas we were working in, there was really active and, sort of dynamic conflict going on. But so we wanted to know, how we needed to pivot the program at that time. And really, in order to do that, we wanted to engage with the clients of our programs to figure out what was really working among, the portfolio of project activities, what was really having the greatest impacts on them and which were particularly relevant to the new context that they were finding themselves in. And so I had at that time a friend who created some telechat software and it actually worked on 3G platforms. So I thought, well, I'll give it a try. And actually at the time I thought, this is gonna be a flop. Nobody's gonna wanna do this. This isn't the way you do focus group work. Oddly enough, the participants loved it. They found that one of the things they brought up at the very beginning of our discussion and again at the end was they said that, you know, we have these various learning partners singing in the United States and such, but we want to engage with you. We do want to engage with you. And these discussions were quite animated, and I just I was surprised. I actually was surprised that you could conduct these qualitative inquiries that way, and that they were so popular. But I think a few lessons from that experience. One, it really did. It was really a breakthrough. We did learn quite a bit about how to pivot programs in that very difficult environment where we couldn't go to the field. We also learned that the barriers of not being able to discuss person to person, could be dealt with through the video part. I think video was quite important, even though the video wasn't as high quality as one might have liked. I think that the other thing we learned was the importance of qualitative work, particularly when contexts are changing. Because when contexts are changing, that's specifically when you need qualitative work to identify how programs need to shift. So it's particularly important in those times because you need to re-look at the relevance of your program, at the assumptions of your theory of change. And so it's particularly important, and it's particularly meaningful to your program clients.
Thanks, Nancy. And Tim or Greg, if you have anything to add, but I think one of the things that this leads into, we've talked about how important it is, particularly when things are changing so quickly, it's dynamic, and you're trying to collect information from the perspective of the participants on the ground to inform that programming. But in light of COVID-19, and that being also quite variable across contexts, and the importance of do no harm, I just want to ask all of you about what that means in terms of protocols, and what are some of the considerations we need to take into account right up front so that we're not increasing risk to any of the people that we're working with. So Tim, Greg, Nancy.
Yeah, this is Tim. I think one of the things that we realized in impact evaluations that we were doing in Ethiopia was that we had to change the way that we actually did interviews since we couldn't do face-to-face anymore. And one of the first dilemmas is trying to find out how many people actually have access to phones that you could call. That particularly when you're doing impact evaluations like we are, we're using panel data. So you're in this recurrent monitoring system that we set up in Ethiopia. We tried to look at what was going on with households and communities over the whole year, doing surveys every 3 months to just capture what is going on. And that last round, we were trying to collect right when COVID-19 actually hit. So we had to regroup. We had to actually figure out, do people have phones that we could actually call? And so one of the things that was really important to our work was that we had contacts in each of the Kabelis that we were working in, and we were able to find out who had phones and who didn't have phones. And we found out that 93% of our sample actually had access to a phone, which was really good because that allowed us to still have a pretty good representative sample of data that we were collecting. Now, the second big issue was trying to make sure that the government was okay with us collecting data by phone, given that Ethiopia is in a big shutdown, and we had to get permission from the various levels of government. So starting at Kabeli, Florida, regional, and federal. And so once you get permission, one of the things that's really important about your protocol is that you need IRB approval, which means that you have approval from the authorities to actually collect this data. And when the authorities themselves are not going to their office, it's very hard to get written permission from anybody. And so you have to rely on verbal permission to enable that to happen. So we've got those permissions, and what we also realized was that, as was already said, the context is changing very quickly, and so we wanted to know in these communities how quickly the spread of the virus was, what the knowledge awareness was in these areas. And so before we launched the survey, before we will launch the survey, we did pre-qualitative key informant interviews with 20 different Cabelli leaders to try to find out what is going on out there, what is awareness of it, are there any constraints? And that information was extremely valuable, not only for determining how we modify the quantitative questionnaire that we were going to use, but also how we modify the existing qualitative information we would be collecting later. I'll stop there and let Greg talk.
Mm-hmm. Thanks, Tim.
Thank you. Thank you. For us, the main thing we had to do was to mitigate the risk of COVID-19 in line with the government guidance and in line with the health professionals guidance. So what happened is to stop the idea of physical contact. We have to really manage our interviews. Without that, one of the key activities we do is food distribution. We distribute food to about 240,000 individuals, which are within like 56,000 households. And we have to know how did the process go. So we use this using a qualitative process, mainly qualitative interviews, focus group discussions. But in the context of COVID, the government clear guidance that those kind of things cannot happen. So we had to shift from doing focus group discussions to changing the entire approach. And what we chose to do with the team was to conduct in-person interviews with clients. So we quickly went into asking our food distributors to collect numbers from clients, because we didn't collect numbers as seriously as we should have. So they did a very good job. Within 1 week, every time they distributed, they collected numbers of volunteers who are willing to give feedback. And we got those numbers, we looked at them from all the implementation areas, and we have like 54 food distribution points. We got numbers from all of them. And then we used those numbers to identify a sample, and we sampled 22 people. Out of the 22, we were interviewing only 5 people within each of the food distribution point. We plan to interview 5 people. So the 5 people include, we try to get diversity in terms of the clients who receive food, and they differ in terms of female-led households and male-led households, and they also differ in terms of direct support clients and the public work clients. So at the moment, the process is at the point of going for data collection, but the main risk we managed there was avoiding physical distancing. And we did a few things in addition, including modifying the tool, because the tool usually had a lot of questions, around 40 questions, that are more generic for post-distribution monitoring. We reduced them substantially, and the aim was to come down to 30 minutes, because we felt you can't keep people on interview for 30 minutes, considering the challenges that they face in the community. And we've piloted the tool, and it has come to, on average, around 25 minutes, but we still want to bring it low. One of the criteria we used to revise the questionnaire was, are there questions we've been asking that we already have answers? So first of all, those questions were dropped out. The other thing was, out of these questions we are asking, are we going to make a decision? And then we only remained with a few questions that are based on what decision are you going to take, and do you have other information that you can use instead of asking the question again for that purpose. We found that a very useful exercise, which helped us to reduce the size of the questionnaire and to manage the amount of time it was done. The last thing I did is I consulted our M&D colleagues. CRS is a very big community, and within East Africa region, we have 7 country programs, and one of them had tried to do interviews as well. And we discussed, and I learned some of the challenges he went through, and I mitigate those challenges by learning from them. Thank you.
Oh, Greg, thank you. I think you touched on a lot of really important points there. And something that came up quite a bit in our registration questions, how do we design? We know we need lighter tools, but how do you decide what to focus on, which indicators to include for, especially for a qualitative approach? And you mentioned that you reviewed your existing monitoring data to identify what you already had, what you already knew, and then some specific gaps of critical information you would need to inform your next distribution. Is that correct?
Yes, yes.
It was really that review
For
of what you
example,
already had.
yeah, using the information we already have, because this is not the first time we are doing post-distribution monitoring. We've done it before. But the question is, are there issues we are told which we haven't acted on,
Right.
that we don't need to go back to the field again to ask people about the question? And the field monitoring staff were very good at telling us those kind of things. The other thing was, are we going to make any decision? For example, distances to food distribution points are known to be a thorny issue. And we have that information. We know that the distance was long. What is the point of asking it again, knowing that you have an action point on your table? So the point was, what decision are you going to take? And is there another source that can give us the same information? Those are the two criteria which we used, and we found they were very useful.
Thank you. And Tim, could you speak to that just briefly as well with the design of this recurrent monitoring survey tool in Ethiopia? Because similarly, you were trying to slim that down, both in terms of the tool, but also how you, what sort of design you use to enable to collect information from multiple sources. Oh, Tim, you're on mute. Great, thanks.
Okay, thanks, Karen. So one of the things that we took advantage of is that the two programs that were being implemented in the Highlands area of this livelihood for resilience programming is that they had been asked by the USAID mission to revise and do response plans given COVID-19 was coming into Ethiopia. So they developed these response plans based on how they thought programming would change as a result of the pandemic. So we looked at the response plans, and we also looked at guidance coming from multiple organizations on what kinds of data we needed to collect for the COVID to get a good understanding of how that was impacting these communities. And so we took that information, we crosswalked it with the existing questionnaire that we had and the topical outlines that we had. And then we decided that, okay, this is what's ideally we want to know. Now, how can we pare that down even more? And that's what prompted doing the pre-survey key informant interviews to find out what was already known out there, what was already happening, so that we could eliminate quite a few questions from the quantitative survey because we could capture that through the key informant interviews. And so it was the interplay between these two, both the qualitative and the quantitative, that allowed us to pare down the actual questionnaire that we're going to be using by phone, which we're trying to get down to 30 minutes or less, just like Greg was talking about. The advantage of it is that there's great information that you can capture through these key informant interviews. It tells you quite a bit about how communities are reacting, what are some context changes that are happening already that you need to be aware of when you redesign your instruments going in for the other survey. The other advantage that we had was because this was a recurrent monitoring survey, this was the fourth round that we were collecting data on. So the enumerators that were used in the first three rounds had already developed quite a lot of rapport with the households that were being interviewed. And so when they call them up on the phone, it's that they already know each other. And so it's more likely that we'll be able to maintain getting quality data from these people. It's not like a stranger that's calling them up and saying, hey, tell me everything that's happening to you, which you might get some reluctance on being totally honest on that. So the fact that our enumerators already knew these households, they had developed this good rapport, really was going to help us be able to collect this data and make it comparable to the other three rounds, which we collected through face-to-face.
Yeah, and Tim, that really gets to a couple of key issues that came up as we were doing some key informant interviews in anticipation of this session. The investment that people have made already in their M&E systems and in their communities and building those relationships is critical. So to build on those relationships that you've already developed. And then the second thing that you both referred to is the importance of these local counterparts. And I know, Nancy, you've stressed that as well, about how that really made the work in Somalia possible. So just maybe a quick comment, Nancy, on best ways to engage those local counterparts.
Yeah, I mean, I rely extremely on local counterparts to help me even guide the do no harm strategies, because often local counterparts, particularly if you have a good representation, not a single one, they're the ones knowledgeable often about what might be the most harmful, but also how you can engage actively, and they can be really great assistance in doing remote interviewing if you're doing focus group work and such. So I've relied heavily. In terms of doing good qualitative work, it's very difficult actually to find good qualitative interviewers. And so one of the things that I also suggest is looking at local universities. They often do have social science departments, and within them you'll find individuals who have worked with development programs before, who often are quite good in qualitative inquiry. But I would point out here that qualitative inquiry is actually harder than quantitative inquiry. And so you really do need people who are relational thinkers. And then again, often local universities will be a source. Local research consulting firms also can be a source of those. But I wanted to also add this local component, being those who are knowledgeable about qualitative inquiry, which, again, it's more challenging than quantitative. And I also wanted to make the point that in Somalia too, we whittled down the quantitative. We actually did a quantitative impact study later on, about a year after the qualitative work. And we whittled down the quantitative instrument fairly substantially based on the qualitative work. And a third point I would add to that is that I don't know if any of you followed the JPAL webinar on doing mobile surveys. But a very interesting point, and I think we should all follow this, is that they were thinking that their aggregation of like the various food expenditure surveys categories might have actually been reasonably functional. So we may find out of this grand experiment where people are forced to do things that maybe we can get away with a lot less data collection in the future. So it might be one of our silver linings here, as we're all forced to move online to do remote work, that we can actually do a lot better at streamlining our quantitative based on, again, good qualitative and on learning from these experiments.
Thanks, Nancy. I think one thing you've all highlighted as well is the way that you're mixing your quantitative and qualitative methods to be able to whittle down, identify critical information needs iteratively. So, Greg, and this also speaks to your point, Nancy, about skill sets that may be different between qualitative and quantitative data collection. Is Greg, in your post-distribution monitoring, you have a very short instrument, maximum 30 minutes, but you've integrated qual and quant into that single tool. So I'm just curious if you could speak a little bit about how you are ensuring that your researchers, data enumerators, are able to kind of balance those two very different activities.
Yeah, so the advantage we had is we used monitoring. We are using monitoring experts. We call them monitoring experts. They are in the 11 of them distributed across 9 of the war headers. They're like districts, and they're the ones who are making the phone calls because they understand the local language very well, and we've been using them to do the collection of the data. So they are all trained MNDX. We have trained them so many times. We've worked with them. We've done a lot of interviews with them. So we do not have a challenge getting them to do this kind of work. So having that kind of a structure helps. Just another point, we also have people we call community animators, who are the ones who are in contact with the households. Because out of the 192 kebeles or villages where we work in, we have at least one community animator. In some, we have 2 or 3. So when we select like 22 areas where they're supposed to go, they're the ones who go and do the introduction with the households to create the trust, to address issues of phones going to be off. They're the ones who make sure like the household is informed to interview at this point in time. Do you need any help in charging your phone, or is your phone already charged? So that aspect of trust is addressed, and then they are told in advance that this person will be calling, and then this person calls. So setting appointments and trying to address that kind of an issue. But in terms of skill set, we work with our monitoring experts or officers in the field. Thank you.
Okay, great, thanks. So it's really, again, around having those socially distanced interactions to make sure that the stage is set that enables a qualitative interaction to happen in terms of the hardware, the electricity, the phone, the SIM card, whatever that may be, along with the safe space and the ability to participate. So that seems really key as well. Now, Nancy, you also mentioned how it may be possible to just be a little bit more focused about how much data we're collecting. And it looks like, Lloyd, you posted the link to the JPAL webinar that you referenced. I think this gets to another really important point around sampling and remembering that our qualitative analysis begins with the research question, which drives the sampling design, which then is going to drive the analysis. So we have a lot of questions about, well, how do we sample? How do we know how much is enough? And what does that mean in terms of our analysis? And if we're able to slim down the amount of data that we're collecting, make sure we're collecting what's critically important, how does that then affect the way that we can do our analysis in a more timely way so that we can inform programming in a really dynamic situation? So Nancy and Tim.
Yeah, I mean, sampling, okay, so qualitative is usually threatened by 2 major issues. One is sampling. And we all know, for example, if you do a qualitative study and you ask an NGO, round me up a few groups of beneficiaries, you know who you're going to get. You're going to get the success stories and such. And, so sampling is important. And the way to think about it, I think, is to look at the different stakeholder groups that need to be reflected in your, in your assessment, and make sure that you have those, and also make sure that they aren't selected, they ideally are not selected by program staff, maybe by community members or key informants that you have in the community, but not by program staff. So I think those are 2 things. I like to have replications in, focus groups and key informants. The size that you can live with usually depends on what you're trying to find out and how many different stakeholder groups you have. So it really, I don't think there's a general rule for it, but those are 2 issues on the sampling. And so I say, set up quotas of, interviews that you want to have within the different stakeholder groups. And, there are common ones, and we know usually we want them by gender and by, different particular particular target groups that we're working with. Now, the other threat is superficial information, right? Not getting deep into, what is really going on. And that's all about the selection of who's doing the work. And like I said, looking for people who are good relational thinkers, who have great rapport and understanding of the communities that you're trying to find out about. But I found that superficial assessment in the name of qualitative work is a really big threat. It's very prominent in both face-to-face work and in online work.
Yeah, it's a really good point. And it's also something that came up quite strongly in an interview with a representative, a researcher with the Food Nutrition Council in Zimbabwe, saying we're getting data, but just that question of how rich that data is. It's a challenge in qualitative work anyway, but under these circumstances where we're trying to do that remotely, it becomes even more challenging. So, Tim, can you speak at all to that in terms of how to ensure you're getting good quality, robust data, particularly in light of the challenges COVID-19 places on us?
Right. I mean, I think the work that we've been doing in Ethiopia, we were at a little bit of an advantage because, like I said, this is a recurrent monitoring survey. So it's a panel data. So we've been talking to the same people around on 4 rounds. And so we have a pretty good idea of what the distribution in terms of vulnerable groups are across those people. And one of the things that became apparent when we were trying to find out who had access to mobile phones was about 70% had their own phones and 30% did not have access to a phone. And so what we were trying to do then was try to determine how can we make sure that that other 30%, which probably are the poorer people in these communities, do have access to a phone that we can actually call and interview them. And so what we found out was that another 23% of that sample actually did have access to a phone, whether it was a relative or a friend. And so we were able to use our key, we have village guides in each of these areas that help support this survey. They're able to actually find out how to make sure that we try to reach as many of the people that are in the panel's data set as possible. And the thing that's important too is that in all of the clusters of areas that we're collecting data, we want to make sure that we've got this qualitative information also in that same cluster. And so even though we've got a number of households that we're interviewing in that cluster, we want to make sure that the qualitative information that we're collecting, which kind of gets at the context and the systems level changes that are happening, is consistent with that cluster. And so it helps us interpret that data much better that we're collecting from the households. It helps us streamline the questionnaire a lot more so we can ask these more systems level changes of the qualitative information, and it helps us verify answers that are coming. The other advantage we had was because we're using the same questionnaire, this is the 4th round, we already know how they answered the first 3 rounds. So we can actually use that as a quality check to make sure that the information we're collecting on this round is actually accurate. Over.
I think one thing that you've also touched on, Greg, did you have a comment? We have a few more minutes in this segment of our session. Go ahead.
Yeah, I can just make one comment. I think for us, the key is to identify how our people differ, the people we want to interview in terms of the questions you are looking for. For example, we identify the livelihood zones is one of the differences that need to be represented. And then the other thing was the female-headed and the male-headed households. They usually have different responses in terms of what we're asking. And lastly, we have got 2 types of clients. The ones who are doing public work, meaning able-bodied, and the ones who are not doing public work. We call them direct support. They're usually the people living with disability and elderly people. So we made sure those are represented while we are selecting the sample, because that's how we felt our data will vary during analysis. Thank you.
Yeah, thank you, Greg. And again, we only have a couple of minutes before we break into groups, but you've all touched on a really important issue around bias. That's particularly heightened and important when we're trying to do remote work. Bias in terms of selection, bias in terms of access, who has a phone and who doesn't. So there may be 90% access, as you said, Tim, but a large percentage of those folks are relying on other people's phones. So is the information, are they free to communicate in an open way? And then that bias in terms of who's selecting the sample. Is it your program staff or is it other key informants in the community? So in the next couple of minutes, if you'd like to just make a brief comment on bias, and then we can come back to that after the breakout groups. So Nancy?
Yeah, bias. I mean, I think that the phone, the remote adds certainly a layer, an additional layer to the bias. So you work harder on the sampling issue, on who you're getting. And there have been different approaches to dealing with for example, the fact that a lot of people who may be your target group don't have phones. That's included distributing phones. It's included, what Tim's mentioned in terms of working out arrangements where that people can get access to phones. And I think the other thing that, that is sometimes used to deal with that is as sort of buttressing it a bit with key informant work. And so, if you don't have any other options, I mean, in many cases, phone coverage is pretty good. It's actually often better than you think, and it's getting better all the time. But where it isn't, you have to have a strategy in place, and those are certainly some of them. Now, I would add that there is another great resource for issues like the analysis bias and so forth. And Vivo is a software platform for qualitative work. And they are actually doing a whole series of webinars on, qualitative work in COVID. And so I'll also share with you a link there. They have quite a good Google Docs page on dealing with some of these issues.
That's great. Thanks, Nancy. I really appreciate the discussion. And we'll come back together after the breakout groups. But with that, I want to just go ahead and turn it over to Maya so that we have an opportunity for our participants to engage with each other and to take a look at all these good questions that are coming in. So thank you so much.
Okay.
Great. Thanks, Maya. And thanks, everyone, for rolling with this and participating in our breakout group sessions. Again, as Maya said, we know that you all have experience and a lot of things that you're already working through, and we wanted to have a chance for you to exchange that. Because we have so many groups and so many interesting questions that have come in, we won't have time to address everything, but as Maya said, we're taking note of that, and we're going to use that to develop some guidance briefs and tip sheets that we'll then be able to send back out to you and post through the FSN network. So thank you very much for your participation. In the time that we have left, we're going to take some of the questions that have come in and pose them back to Tim and Greg and Nancy, and then also create some space. Again, we know that many of you have answers. I was in a breakout group where there was already a discussion of how to deal with this question of bias, which is so important. So we're going to try to make some space for those of you participating to respond to these questions as well. So the first question we're going to take is, how do we reach young adults and youth, especially if they don't have access to their own phone or a safe space? I know this is something that you did touch on just briefly, but how do you handle that? How do you make sure that you're creating a safe space or that people have access? This gets back into that question of bias and do no harm. So Nancy? Well,
Youth, like I said, we were doing remote focus groups with youth groups. I think that you'd be surprised how many youth probably do have phones, and that you can always, with any interview that's remote, have as an initial, inquiry whether or not they are able to talk, whether they are in a safe space. So that's a possibility. I think there are a lot of, I would like to hear from the participants, because I think a lot of you have experience. I would also throw out that if you have programs with youth groups and they have WhatsApp, for example, that might be an option both for conducting remote monitoring, but also for, in fact, analyzing information about what, qualitative inquiry into that, the data that comes out of WhatsApp activities.
Karen, I could say something about that too. One of the things that we try to do for people to make sure they're in a safe place when they talk to us is we actually schedule the phone call at a certain time so that they can do that planning to make sure that they're in a safe place to talk to us. So particularly for people that might have to borrow a phone, we want to make sure that they aren't just going in and started talking to us when everybody else is around, but they actually, it's scheduled like tomorrow at 2 o'clock, we're going to be giving you a call, try to make sure that, you're in a place where we can actually have a private conversation.
Great, yeah, and thanks. And Greg, you had also mentioned the role of the field monitors and having these kind of pre-checks. What kind of results are you seeing from that? Are you hearing that that's an effective way to manage that issue and try to make sure that we are able to reach women and youth?
Yeah, so two things. When you collect a phone number at household level, the question that comes is whose phone is it? Because that's what makes it impossible for other users in the household to get access to the phone. So it's always good to have a way of intentionally identifying the youth if you want to get in touch with the youth for during interviews and trying to reach them using people who know them. Like our community monitors who are in every communities, they are good at that. They help us identify the different people. Initially, not on Qualitative, but even on other interviews, we used to get a challenge having youth and women participate because we are doing household interviews. We are being left out most of the time. But unless we start being intentional and asking, we need youth age, this age to this age, it's difficult to get them. And then where they have difficulties in accessing funds, when you have resources as a project, you may want to make that access, those funds available to them for calling purposes. For example, in our project, we have some tablets which we can give community animators to take to households who do not have phones, and then after that, they might return it. Thank you.
Okay, great. Thanks, Greg. And one of that kind of like leads into another question that's come through. So what do you do if you're working in areas where people simply just don't have access? They don't have phones, they don't have network connection, they have no connectivity. What does that look like? And with that, if you have some thoughts, but also I'd like to bring Alpha from the Food and Nutrition Council in Zimbabwe into this as well. If you're able to turn on your camera and maybe share for just a moment how you've managed socially distanced focus groups across 60 districts there. So Alpha, if you're still online with us, go ahead and turn on your camera and unmute. And in the meantime, if others of you have some thoughts and would like to respond, again, just turn on your video and so we'll know that you'd like to make a comment.
It says the host has stopped it. My video is saying the host stopped it. Okay, that's better.
Alpha, welcome.
Okay.
Thanks for being here.
Welcome, thank you. Thank you so much for having me. So what we have done to have focus groups in the 60 districts is that we identified our participants among the critical staff. Like by critical staff, I mean people were allowed to go to work at this time of COVID. And so we managed to identify 5 people in each district that can participate in this. So of those 5 people that were participating, we identified one person that was going to be the facilitator. So that facilitator, we had time to take them through the tool and what we expect from the tool and how they are going to send us the information back. That was more like on a coaching basis via the phone and sometimes via Skype. So that was the process that took 2 days. Then in terms of the setup for the meeting, these people work in an institution where they would go undergo fever screening. Every morning when they get to work, they go through fever screening. They have to put on a mask for safety. And so in the meeting setup, they observed the minimum distance, social distance in the meeting. So the meeting will be having like 4 to 5 people. And so they have this discussion around the tool. And then when they are finished completing the tool, they sort of, they send it to us via an online system. And maybe most of us will be familiar with Honor. So we had a tool that we designed in Honor that people can, that they will just fill in after the FGD and send the information to us. So because we had been doing this over the past number of years, we're able to pre-code some of the issues that were coming up so that we don't have too much a wide set of answers. So yeah.
So you've been able to conduct those focus group discussions in a socially safe way, aligned with government regulations.
Yes.
And you mentioned ONA. We'll see if we can get a link to that in the chat box, so people can have an idea of that particular platform and tool. So
Karen?
yeah, thank you, Alpha.
Karen?
Okay.
Nancy.
Yeah, I would just mention that, the context of COVID is going to change, and, there are places where there is low transmission and we're finding that out. So I think one of the things we have to keep in mind is that it is going to be context driven as to whether or not one can consider in-person interviews. And of course, good training and protocols have to be in place for those teams. And that has to be institutionalized in the partners, because it's, there are standards of practice and everybody should be observing them.
Yeah.
Thanks, Nancy. Yeah, and that gets to a number of other questions that have come in. Initially, when we came up with this idea for the session, came up with the name Focus Groups from Afar, trying to get people's attention because it seems counterintuitive. How can you do a focus group from afar, both in terms of remote facilitation, which you've done, Nancy, in Somalia, but also in terms of the spacing among our participants? So is there any other guidance or any other tips or strategies that you'd like to mention around focus groups? Because we tend to think more, and we're able to get a lot of information from those key informant interviews as well, but a lot of questions around FGDs.
I think okay, so, the content focus of FGDs is quite important. And I think the notion of, I personally think, particularly in these contextually challenging times, that, focus group inquiry that really follows along the lines of most significant change or outcome harvesting. But those are things that beneficiaries engage with really quickly. And so that, it's easier to get those kinds of focus groups off the ground with that line of inquiry. So a question came out around the numbers of focus groups, and it is driven by saturation. When you start to see in your different stakeholder groups, when you start to see you're getting pretty much the same information, that and somebody mentioned 3 to 5 groups per stakeholder category. That's kind of typical, but you probably should be open-minded to needing more if it turns out that you're not seeing saturation quickly.
Nancy, thanks for that comment as well. As you said, it gets to another key question of how much is enough, and there's a real tendency to think that more is better. We have a question specific to that. And again, this gets to the issue of design, and also under these circumstances, how flexible can we be? What are some sort of minimum standards for knowing when enough is enough? Tim, can I turn that one over to you?
Well, I'm notorious for having questionnaires that are way too long because I'm interested in everything. So it's been an interesting journey for me, where I think that it really helps to have a team that actually helps whittle down what you should be focusing on. Some people have to give up on certain sector questions so that we can make it doable. And so making sure everybody that is helping to whittle down these instruments gets the minimum that is important to that particular sector, but isn't exhaustive like we often are. The other thing that I think is important is a lot of the questions that might be impacting the whole community can be geared towards the focus group or key informant interviews, and the things that are particularly having an impact on households are the things that you should focus on in the questionnaires. And so I think it's important to differentiate which instrument's going to be more valuable for which types of information that you want to collect. And then you can shorten that questionnaire a lot more. It's really important. I think if you end up talking to somebody for 45 minutes or an hour on the phone, you pretty much ruin your chances of talking to that person again, because they are maybe reluctant to engage in such a long conversation. Oftentimes where we have not great connections, you might have to call them back a couple of times to get all the information you're trying to collect. So that can be a problem too. So we need to think about, and one other important point here is that I think that we have to really think about topping off time on phones so that we have an incentive for people wanting to talk to us. One of the things that's happened in a lot of these surveys is that you get a lot of attrition when you go back to talk to these people again if there is no incentive for them to actually participate. So one of the issues around that is if people are borrowing phones, who gets the incentive? Is it the person that had the phone that is borrowed from, or? So that's always an issue that we're still trying to figure out is like, how do we make sure that the people that are actually talking to us actually get the incentive?
Yeah,
So,
that's a good point, that they may have access to a phone, but it might not be their phone, and the phone they're using is the one that's getting compensation and credit.
that's right.
So this gets into, again, that question, a few questions that have come in around creating incentives. I know, Greg, you talked about one of the biggest challenges was not so much credit or access to the, the SIM card, but electricity and the distance that was required for people to charge. So how have you addressed that?
Yeah, so in the context where I work is like rural households don't have electricity. So some of them have to go to this market center to get the phones charged. So when you're doing an interview that will last 30 minutes, you know that you are taking part of that credit. So one thing we did was to make an appointment with them, and we make it clear that are available to support the process of transferring the phone to them for charging purposes. So that's something we do with them. That was that's not just with our survey, but most of the surveys we've done in organization. The issue of credit, we manage it because we can put credit on their phones, and a lot of the ones who call, we call them for that. But the issue of the phone charge is the one which we have to work with our community animators to support with that. Where they just don't have a phone, we have devices, some small Samsung tablets, which we take to them and they use it for that purpose, and then the animator takes it back again. Yeah.
Great, thanks, Greg. Yeah, we have a lot of questions coming in. I think I want to just get back to this issue of sampling that keeps coming up. And Tim, you talked about how much is enough in terms of our tool, but also how much data is enough. And that, again, leads back into this question of analysis, because there's we understand, and there's a general assumption that analyzing qualitative data takes a lot of time. So in terms of being able to manage that, Nancy, you'd mentioned, quota sampling, but really having clear categories of people you want to speak to and identifying key individuals and collecting a minimal data set. So I would just, again, that's come up several times as questions. So are there any other comments on that in terms of, what do we really need as a comprehensive data set?
It really depends on the purpose of the work. And so I don't think you can say anything generalizable. We sometimes do qualitative components that are quite small in terms of the actual number of key informants and focus groups that we do. And so I think the real issue is, are you doing this as part of an impact evaluation? Are you doing this as, part of understanding context, getting a better fix on context? So I think that it's really difficult to make a generalizable statement. I think, though, the one comment that came out of the field, out of the participants about, when do you reach saturation in focus groups and the 3 to 5 per stakeholder group is probably not a bad, not a bad rule of thumb for focus group discussions. However, like I said, you have to keep it possible, be flexible in case you're finding surprises in the field or you're finding new stakeholder groups that you didn't think were distinct, and that can happen. So
be constantly reviewing and iterating your data and identifying those gaps, and that's where you focus in your future inquiry.
Yeah.
So it's just about having a much more focused and finer tuned approach to our qualitative work.
And adaptive measurement, which is
adaptive measurement.
Yeah.
Excellent. I see the name of the tip sheet. Something that we also haven't really talked about are these digital platforms. And I know we asked folks to enter in the chat box what sort of platforms or mechanisms they're using to collect information. Nancy, you mentioned WhatsApp. You know, we talked about cell phones. You used an encrypted platform for FGDs in Somalia. We don't want to spend a lot of time on that question now because IDEAL will be hosting a whole session focused on digital technologies for remote M&E, and we'll include some qual and quantitative both in that session. But any other thoughts or any participants who have some platform or technology that they'd like to recommend? You know, Alpha, you mentioned ONA as a way where you can actually enter some short form qualitative data. You find that to be fairly useful?
Yeah, actually, ONA is quite very useful because you can create a web form that they can access online and save for offline use. So the person doesn't need to be online all the time. So they have to be offline. And it also takes away that task of having to program the device that they are on. If they've got a smart device, you just give them a web link, they go onto it, and they are able to access the form from there off. So it's quite an easy tool to use. It also works like Engato. So the web form version is the one that's best because now for you to be able to program, like in our case, would have needed to program about 60 devices and move them around. So with ONA, you just had to program your form, put it in a web form, and people just access it from there on. They can save it for offline use, so they can refer to it during the meeting. They can spend an hour offline, and when they are done and they are sure that the information is correct, they just submit it back. Let me try to get to it and show you. Maybe if we've got time.
No, Alpha, we only have a few minutes left in our session, so perhaps what we can do is provide that link to folks that they can take a look at that online. But I think one thing you mentioned to me as well that, you know, in our analysis, not using a software package for qualitative, you know, often we try to keep it very simple in terms of Microsoft Word matrices, doing some filtering with Excel, and with ONA, you can export directly. You can export text to Excel and sort of filter and manage your data in that way. So you're not losing some of that richness. Great. Thank you. Again, we only have about 5 minutes left. So I just wanted to kind of come back to some of the principles we started with around do no harm and creating safe spaces. Some questions coming in about what strategies can we use to interview people who may be reluctant to participate? And that may tie into questions around safety and security. You know, one of the things we talked about is, you know, at the top of our topical outline for our qualitative interview, to start with some closed-ended questions. Are you in a place where you can participate safely? To give people the option to say no, and that's when the interview stops. So do you have any other thoughts or tips? And again, those of you in the room, any tips or thoughts on how to ensure that the do no harm principle is first and foremost in everything that we're doing?
Well, one thing I can say about that is that we have people that we work closely with in every one of the cavellas that we're working in, and those, we call them guides, and those guides are the ones that try to make sure that people that are going to be talking to the enumerators are in a safe place. Otherwise, they'll call the interview off. And so, so we try to make sure that those people in the cavellas or in those communities are in a position that prevents that from happening.
Great, thanks, Tim. I really just want to thank all of you for your participation today and just your thoughtfulness and helping to remind us all that, yes, we can do qualitative work. We need to just think about it differently in terms of the objectives. How much information do we need? What are those critical information gaps, as you noted, Greg, that we're not collecting more data than we need, So we're keeping it as tight as we can, and paying very close attention to the sort of rules and regulations and the changing context in which we're working. So I think you've helped us to kind of think through some of those issues. Similarly, very much appreciate all of the input from our groups. As noted, we've captured that, and we're going to use that in order to better to better serve our community in the future, through communities of practice, through tip sheets and guidance notes. So we just really, really appreciate all of that. And with that, I'm going to turn it back over to you, Maya.
Yes, thank you. A couple of things. First of all, as evaluators on this call, we would love for you to evaluate this event, this experience, so that we can improve. And as you know, we're also in a space where we're testing out these online platforms and ways of meeting and talking and discussing with each other between implementers. This was a very big meeting. We're hoping to also hold smaller sessions where we can be more intimate and really have deeper conversations with each other. So this was one way of doing it. Would love to hear what you thought about it and how we can improve. There should be a link in the chat box to an evaluation of this event. Another thing we'd like to hear from you is a poll. I think that there's a poll that we can pull up now around communities of practice. If someone can please share that poll. Please fill that out as well. We just want to take the pulse and see how you would feel about participating in a community of practice around qualitative M&E. So if you wouldn't mind filling that out too, that would be great. And yes, I think that was it from me. Karen, what else did
Nope, that's great. Thanks, Maya. I just also wanted to remind everyone, if you haven't already subscribed to the FSN Food Security Nutrition Network newsletter, it'll keep you up to date on the other events that are part of this series on M&E during COVID-19. So keep a lookout for that. And then we have another final request as we sign off here at the end of our time, for everyone to turn on their screens and wave. I think we have about 136 participants now, because we are the foundation for a future community of practice around qualitative methods. So thank you all for your time and participation today.
Thank you so much.
Thank you.